Welcome to all. This is PK Studies. The topic today we are going to discuss is hypospadiasis. Hypospadiasis is basically congenital birth defect of the urethra, which primarily affect the boys. And here hypo means which means below, that is present below. Now to come to the introduction. Hypospadiasis is a congenital condition where the opening of the urethra is located on the underside of the penis rather than at the tip. This affects urination, sexual function, and often requires surgical corrections. Then our next part is definition. Definition and prevalence. Hypospadiasis is congenital defect where the urethral opening is located on the underside of the penis rather at the tip. It affects approximately 1 in 250 to 300 male birth and is one of the most common congenital abnormality in newborn boys. And then our next part is causes and risk factor. Causes. Hypospadiasis is a congenital condition. It means it developed during the fetal development. The exact cause is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Risk factors of these include maternal diabetes, obesity, advanced maternal age, and exposure to the certain medical or chemical during the pregnancy, which means if the mother is having diabetes, obesity, or the mother is too old, and any exposure to chemical or medication during the pregnancy, any accident, it will it is possibly cause the condition. Identifying and addressing these factors may help to reduce the risk of hypospadiasis. Then our next part is anatomical characteristics. Hypospadiasis is a congenital abnormality where the opening of the urethra is not located at the tip of the penis but instead in the other side. The urethra may open anywhere along the shaft of the penis, at the base of the penis, or even at the scrotum. It can lead to a curved downward pointing penis known as the cody. One more severe case is the penis may also be abnormal, short or small, and the foreskin may not develop properly, resulting in an incomplete foreskin covering the head of the penis. These anatomical variations pose function and cosmetic changes that often require surgical correction. Then moving to the next part, it is diagnosis and evaluation. Hypospadiasis is typically diagnosed at the birth through a physical examination. That means we can observe only by physical examination whether the condition is present or not. The healthcare provider will assess the location and severity of the urethral opening, the shape of the penis, and any associated abnormality. Further evaluation may include diagnostic imaging such as MRI, means magnetic resonance index, or to evaluate the internal anatomy and the plan to appropriate surgical approach. Then surgical treatment option: hypospadiasis repair, stagged procedure, then reconstructive techniques. Hypospadiasis repair include the primary surgical treatment for hypospadiasis, and this involves reconstruction of the urethra and repositioning the urethral opening to the current location. That means surgically placing the urethra to its correct position. Stacked procedures: complex cases may require stacked surgery performed over multiple sessions to achieve the desired outcome. This allows gradual tissue expansion and correction. This means in this stage procedure, we perform the action stage by stage by treating the condition one step by another step. Constructive techniques. Reconstructive technique: the surgeon advance by grafting, flap, tissue expansion to create the natural anatomy and optimize function and cosmetic result. This requires the cosmetic surgery to make it possible by in artificial way, by the surgeon make it by their own, not naturally. Then come to the timing and technique of repair. Then optimal timing: the ideal timing for hypospadiasis repair is typically between 6 to 18 months of age. Basically, when the child is small, it is best for the surgical treatment. When the penis is still small and the surgery is technically easier. Then surgical approach: the common technique include tubularized in size plate, that is deep repair, metal advancement, and granuloplasty, and two-stage repair. The specific approach depends on the severity of the hypospadiasis. Surgical principle. The key principle include creating a neurourethral repositioning and urethral meatus and achieving optimal cosmetic result through granular and reconstructive and penile straightening. And then next part is post-operative care and complication. Post-operative care include close monitoring of the surgical site, management of the pain, prevention of infection, and crucial during recovery period, which is generally part of our nursing. Catheter management. As the urinary catheter may be necessary to allow the urethra to heal, proper care and monitoring of the catheter is essential by the emptying the catheter, proper insertion and proper care of the catheter should be given. Wound healing. Ensure proper wound healing is critically prevent complications like fistula formation, urethral stricture, or any infection. So the wound healing is also a main point to take care of. Potential complication. After the post operative period, the complication that may arise maybe risk include infection, bleeding, wound adhesions, fistula, urethral stricture, which may require additional intervention. Then the next part is long-term outcome and long-term outcomes and consideration. Functional outcome. It is functional outcome means what should we observe by the operation. Improve urinary function and cosmetic appearance means urinary function will improve and will gradually restore to its normal, and cosmetic appearance means the appearance that was not well before will gradually become normal. Psychological impact means a positive self-image and confidence in the patient due to the condition. The patient and their relative may feel any type of they feel a psychological like depression like this condition, so they will feel well. Potential complication like risk of fistula, scarring, and sexual dysfunction, this will also be considered. The long-term outcome of hypospadiasis report focus on the restoring normal urinary and sexual function, as well as improving the patient's psychological well-being. While surgical techniques have advanced, there is still risk of complications such as fistula formation, scarring, sexual dysfunction that require ongoing monitoring and management. Then conclusion and key takeaway. It includes the comprehensive management. Hypospadiasis require a multidisciplinary approach involving urology, pediatrics, and plastic surgery for optimal treatment and long-term outcome. Then individualized care. Each case of hospitalization hypospadiasis is unique. Emphasize that need for the personalized evaluation, surgical planning, and post-operative monitoring. So we should give the individualized care to every patient that face hypospadiasis. Important timing. And the timing of the surgical repair is crucial, typically between 6 to 18 months of age, to ensure normal gentle development. So we should consider the timing of the surgery, because when the baby is between 6 to 18 months, it is the best time for the surgery that will ensure the normal gentle development. Positive outcome. With appropriate treatment, most individuals with hypospadiasis can achieve functional and cosmetic results, leading to a good quality of life.